Well, good morning. I've known Linda for over 30 years, and I think she demonstrated very well her competence as a master educator. I've known Linda speak in many forums, and I think she did a great job today in providing both a thoughtful and a comprehensive view of competence and how we think about it from multiple perspectives. My view of this has mainly been in the Royal College in Canada from the perspective of continuing professional development, and I thought I'd pick up a few themes that I thought Linda articulated well and just expand on them a little bit as I've thought about it from continuing education systems. In part, I would think we might think it's self-evident that most of our educational systems have been developed and designed to achieve individuals who are competent and who are expected to perform well. So when the discourse around competency-based medical education evolved in Canada, at least over the last few years, in part the reactions were varied. So it was surprising to some. It was stimulating to many, and it evoked a number of different responses from a wider variety of individuals, both challenging the whole concept that we need to change, and some worried about some of the implications of it. It certainly challenged, from a postgraduate or residency education perspective, how we thought about the structure, the content, and some of the metrics that we were using within medical education, within residency training, and Linda illustrated that very well, both from her own personal experiences, and many of us can relate to that time-based process. As I've thought about it from continuing professional development, it has really started to challenge some of the autonomy issues of the independent practicing physician in terms of how they think about and organize and manage their lifelong learning. It has challenged them to think about it from the perspective of choosing to engage in lifelong learning that is anchored in what they do, in the scope of that professional practice that Linda reflected, to achieve the metrics of not just expanded knowledge, but to think about it from the perspective of achieving an enhancement of skills and competencies and performance. The fact that we all have competency frameworks has certainly enabled us to think about the teaching-learning interface and how we think about assessment of competence. But for CPD, this has been a relatively low-level strategy where we've tended to focus on the metrics of declared learning, or at least commitment to change as being the predominant focus, not assessments that Linda talked about that are enabled within the workplace. Linda mentioned something about progression of competence in her talk, and it's a phrase that I think is important for us to think about, not just from undergraduate education and postgraduate education, but what's the concept of progression of competence for the practicing professional. Some of us think that one of the roles of CPD is to take the competent resident who enters into practice and enable them to grow in competence towards achieving expertise and, for some, mastery. So it's not just maintaining, I hit that 3 times, not just maintaining the knowledge and skills that they acquired, but to actually grow through their practice as they apply this and learn. For me, the focus on competence from a CPD perspective is going to challenge us in 3 ways, and let me just articulate what those might be. To me, I think as I look at most of the outputs of our national specialty societies and the Royal College in Canada in terms of what we teach practicing physicians, it isn't anchored in the full petals of the CanMeds framework. It's still mainly anchored in the medical expert role, and we struggle to think about how teaching and learning can be operationalized across all of those CanMeds competencies. The second is for some, the disturbing literature on the accuracy of physician self-assessment, that we have very poor abilities to assess our actual performance against external measures of same. And so part of the imperative of CPD is to shift from an exclusive focus on group-based learning to assessment as part of the educational imperative of anchoring educational strategies against the professional needs, not the ones we just perceive we have, but the ones that we cannot perceive unless we get data and feedback about how we're doing. And the final challenge is what the expectations of society is going to be for the profession. We have just implemented revalidation programs in 6 of the 10 provinces in Canada over the last 2 years. The definition of revalidation in Canada is demonstrated commitment to competent performance in practice. We simply can't demonstrate our competent performance in practice sitting in rounds or in group meetings such as this. We have to do something more than that. And that's going to be a challenge as we shift our systems increasingly over time. And I hope that might stimulate some of the discussions we might have later.